Clinical practice in BC has fundamentally changed in the last couple of years. We've got dedicated leads now that are specifically tasked with looking at how we can develop our care and better models of care for patients across the province.
BCEHS and paramedics in general have been responding to patients with palliative needs since BCEHS began. People have always called 911 in times of crises, especially when experiencing a crisis related to a palliative need.
What we've been focused on over the last couple of years is looking at how we can transform the model where we've traditionally taken patients to hospital and actually look at how we can connect them in with the broader healthcare system.
What our mandate is to appropriately connect you to care that you need. And that care can look very differently. And for a patient with palliative needs, their care is often not found in the emergency department.
The opportunity to attend to a call that is palliative in nature is fairly common.
I think it's a good program in that it is formalizing, that it's putting into place what has been informal practice for most of these communities already. Having it formalized gives us the ability to communicate to the rest of our organization what it is we're accomplishing on the scene for this patient. It gives us a tool to communicate with their family, with their physician, if their physician happens to be a part of it. It gives us those tools in a way that we didn't have before. Before it was, we had to justify all of the decisions that we weren't going to transport this patient. Now we have to justify why we're transporting the patient.
It helps us to be at ease about what's going to happen to our patients out of hours, because this is when we are not available. And it's pretty much the only service available on Gabriela Island at night, paramedics. So when they arrive and they are in the picture of what's happening, I think everyone feels better about this.
In our early days, we did a lot of work into understanding the why behind the reason for the 911 calls. And what we landed on was that essentially people call 911 because they've got no other choices or they're not aware of any other choices to make. And they're calling 911 because they want help. And our job is to facilitate that care on arrival at scene. And when we get to scene, the patients don't always want to go to the emergency department. They just wanted some help. And so by giving them access to paramedics to the clinical pathways, what we're actually able to do is inform patients and educate them around their care options and options that are available to them.
It's such a difficult time for them. You know, their family member is dying, and paramedics show up in their uniforms, and the last thing that they actually want is for that patient's last wishes of dying at home to be stripped from them.
We have a number of different steps in place where we can identify patients' care needs. That starts with our call takers, our dispatchers, and our secondary triage clinicians, as well as paramedic specialists, that sometimes look to actually take the calls and not send an ambulance and deal with the patient over the phone and try and access and provide the care that they need without sending an ambulance. And then when we do make decisions around what resources are appropriate to send, we have a range of different vehicles that we can also dispatch based on needs. So we're not always dispatching a double paramedic ambulance to some of these calls. We have a whole range of different vehicles that are available to us.
And in some cases there is no option. They do need to go to the hospital, but that is forming a smaller and smaller percentage. And as time marches on, we're realizing more and more what the skills are that are needed in order to keep patients at home that want to stay at home, and that's really what we're focusing on. You
know, patient advocacy is number one, right after our personal safety, so let's see what we can do for this patient in the here and now.
It may seem a little bit counterintuitive initially to the paramedics that they're spending a lot more time on scene than what they're used to, but when you actually look at the overall time, it's quite significantly reduced.
It actually leads to less repeat 911 calls. So if we take the time, we put it in, it actually frees us up typically sooner than if we were to transport this patient to hospital.
And what that means for the rest of the patients and the rest of the paramedics in the system is that the resources become available quicker to attend to more calls or higher priority calls when they're needed.
So we're a resource that's available for the next person who needs us quicker.
So the goal is, what is the best possible patient outcome? We want to get there.